Hello everyone, my name is HuiWang. Today I'm going to talk about telehealth. What comes into your mind about telehealth? Have you thought about having a video chat with your doctor through your mobile phone or computer? What about grandma monitoring her blood pressure and sync the data in real time with the hospital? Does the doctor need to be in the same room to do your exam? What about surgery? Is the electronic medical record part of the telehealth? Have you thought about remote medical conference or medical training? What about mobile health? The list goes on. In this presentation, I'm going to talk about what is telehealth, why is telehealth relevant, and telehealth applications, and some examples, summaries and questions in the end. First, what is telehealth? In short term, it's telecommunication and healthcare. The Health Resources and Service Administration of the U.S. Department of Health and Human Services defines telehealth as the use of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient and professional health-related education, health, public health, and health administrations. In short, it's remote healthcare enabled by digital information and telecommunication technologies. There is much debate in the healthcare field about the difference between telehealth and telemedicine. Many companies use the term interchangeably. The difference are their scope. Telehealth can encompass not only healthcare services, but also non-clinical health education and public health programs. Telemedicine, on the other hand, is a niche within telehealth. Telemedicine involves a healthcare provider using telecommunications technology to provide healthcare to patients. Telehealth technology is constantly evolving. Several decades ago, physicians and other health professionals engaged in telehealth using radios and telephones. Since the advent of the Internet age and the widespread use of smartphones, telehealth technology has changed dramatically. Only a few critical ones listed here: Internet, smartphones, wearable device, electronic health record, GPS, etc. Economics discuss about demand and supply relationship. This also applies to telehealth. The primary factor driving demand are population growth and an increase in the number of older Americans. By 2020, the number of Americans older than 65 is forecasted to increase by 36%, while the physician supply only hardly keep up at 7%. As a result, physicians will be shorthanded. This will have the greatest effect on the approximately 20% of the population that lives in rural and underserved areas. How do we address this challenge? One solution could be telehealth. Telehealth can make healthcare accessible to people who live in rural or isolated communities, can make service more readily available or convenient for people with limited mobility, time, or transport options, can provide access to medical specialists, can improve communication and coordination of care among members of a healthcare team and the patient, can provide support of self-management of healthcare. There are many different applications for telehealth. For example, personal health apps can store personal health information, calculate and track cardio intake, schedule reminders for taking medicine, record physical activities such as your daily step count. Within patient health record or patient portal, you can view personal health information, make payments, schedule appointments, see prescription lists, view test results, and it can be done 24/7 through your PC or your mobile phone. Doctors can also take advantage of technology to provide better care for their patients. One example is a virtual consultation. that allows primary care doctors to get input from specialists when they have questions about your diagnosis or treatment. Remote monitoring: a variety of technologies enable your doctor or healthcare team to monitor your health remotely. Technologies include wearable devices, home monitoring devices for older people or people with dementia that detect changes in activities such as falls. Virtual appointments enable you to see a doctor or a nurse via online video conferencing. Surgeons can do remote robotic surgery, in other words, telesurgery. There are many more. In the next few slides, I would like to give some examples. The first one is New York Presbyterian Hospital. It's a nonprofit university hospital in New York City. It's ranked as the top 10 best hospital in the US and number 1 in the New York City metropolitan area. NYP expanded its Express Care telehealth program last year to New York's Washington Heights neighborhood. The online virtual care service did not catch on with residents. The executive took a look at their targeted population. This population are familiar with walking into their primary care site, but not familiar with phones at home. It's an underserved chunk of the Big Apple. Among a population of 150,000 people, there is 30% Medicare, 30% Medicaid, and a large group without any insurance at all. Instead of focusing on connecting patients in their homes to care providers, NYP installed telehealth stations and trained staff to triage patients into the office. If those patients could be seen via virtual care, they are given the opportunities. That changed everything. Suddenly, the program took off. The success of the program can be seen so far by reduced crowds in both the office and the local emergency rooms, and a reduction in waiting time from 2 hours to 30 minutes. Another example is telesurgery. When Dr. Marin Avari picks up his surgical equipment and cuts into somebody's flesh, he doesn't use his own hands. In fact, he's not even in the room. He operates on patients that are about 250 miles away. From a console in St. Joseph's Hospital in Hamilton, Canada, he controls a robot in an entirely different part of the country, slicing, stitching, and removing bits of the body. He's carried out more than 20 operations, including colon operations and hernia repairs. The third example is telehealth in rural areas. Approximately 62 million Americans, or 1 in 5 people, live in rural areas, while only 9% of all physicians practice in these settings. University of Virginia Health System serves a large rural footprint, including the coal fields of southwestern Virginia, one of the largest medical underserved populations in the state. Access to timely, high-quality care in these areas is limited, and patients sometimes need to travel long distances for care. Through its telemedicine program, UVA has conducted more than 40,000 consults via telemedicine across more than 40 specialties. It saved patients nearly 9 million miles of travel. That is huge. Next example is from Eastern Washington Elementary School in Pekin, Indiana. Telehealth technology connects elementary school students to doctors online. If you got a sick kid at school, you may not have to leave work. The new telehealth program provides a tool to schools, letting doctors and nurses diagnose sick children, in some cases from the school directly. Telehealth has shown its value and will continue growing. 70% of the employers plan to offer telemedicine services to employees in 2017. 57% of doctors are willing to see patients through videos. 64% of Americans are open to have video visits with their doctors. There are some challenges as well. It's not uncommon in rural America that broadband communication is poor. Sometimes there's non-existing broadband connections. There are cybersecurity risks for digital information. There are license and legal issues. With telemedicine, the physician and the patients may be in different states. When this happens, in which states is medicine being practiced? A lot of those questions need to be regulated and probably need a law to regulate those. In summary, we have talked about what is telemedicine. In short, it is telecommunication and healthcare to enable the remote and long-distance healthcare. Why is telehealth relevant? Because the demand is greater than the supply. There would be a shortage for physicians, and telemedicine could provide a solution for this. Also talk about the applications and the examples. Examples include it can be used in rural areas or using virtual appointments or even telesurgery. Next is the questions. Are the questions for you guys. Have you or your family, close friends, used telemedicine before, telehealth before? If so, what are the experiences? If not, would you consider using it in the near future? Do you think telehealth will become more and more popular? In which area do you think it will boom or suffer? What needs to be done to facilitate the development of telehealth? I hope this presentation is helpful. These are the sources for this presentation. Thank you very much.